We all try so hard to keep our pets safe, right? But sometimes danger's hiding where you least expect it, like those common bug sprays or flea treatments we use. Ever pause and think what they might actually do if our pets get too close? Today, we're going to take a closer look. We're doing a deep dive into neonicotinoids.
Right. They're a type of insecticide, chemically kind of similar to nicotine, actually. You find them in lots of things, flea products, stuff for termites or lawn grubs, even in agriculture.
And we've been digging into some material from neonicotinoid poisoning in animals for this. Our mission today, really just get the basics on neonicotinoid issues in pets, mainly focusing on dogs.
Okay, so let's break it down. How do these things even work? Well, in insects, they latch onto specific nerve receptors, nicotinic receptors in their central nervous system, and basically short-circuit them.
Okay, sounds effective for bugs. But what about mammals, like our dogs?
That's the interesting part. The receptors in mammals are different subtypes. These chemicals are, designed to fit the insect receptors much better. So usually there's quite a wide safety margin for mammals.
Usually. That's good to hear. A bit reassuring. So how are dogs getting exposed then? I mean, they aren't seeking this stuff out, are they?
No, definitely not. The number one way dogs run into problems is ingestion.
Eating them. Eating them. Like what?
Think about chewing on those plastic ant bait containers, or maybe gnawing on a flea collar that fell off, even the boxes for the tablets, or licking up spilled liquids.
Okay. That makes sense. Dogs do chew on everything.
Exactly. And it's worth noting, this seems to be much, much less common in cats. Maybe they're just pickier eaters, or maybe it's the grooming habits, but it's mostly a dog issue reported.
Right. Every dog owner knows that story, the mystery item chewed up.
Right.
So, okay, they eat some. What signs? What should we be looking for? Is it immediately obvious?
Well, first, some good news. There was a study with imidacloprid, that's a really common one, and they gave dogs and cats 5 times the maximum dose and saw no adverse effects. So there is a buffer.
5 times? Wow. Okay. That is a decent buffer.
It is. Now, if it's just skin contact, say from a topical product, sometimes you might see some localized stuff, like maybe some hair loss or redness right where it was applied.
Okay, skin irritation. But what if they do manage to eat a significant amount? More than that buffer covers.
Right. If the dose gets high enough through ingestion, the most common thing people report first is hypersalivation. Just lots and lots of drooling.
Excessive drooling, okay.
Right.
What else?
You might see them become less active, lethargic, maybe tremors, muscle twitching. Their pupils could get really big or really small, and they might walk funny, like they're uncoordinated.
Wobbly gait.
Yeah. And at really high doses, they've even seen hypothermia, their body temperature dropping.
Okay, that does sound serious. If, someone listening thinks their dog got into something like this, what's the absolute first step, and what should they definitely not do?
Good question. If it's on the skin, wash it off immediately. Use regular liquid dish soap and plenty of water.
Dish soap, got it. What if they ate it?
For ingestion, you can give a little bit of cool water just to help dilute what's in the stomach. But, and this is crucial, do not try to make your dog vomit using hydrogen peroxide. Please don't.
Cyanide peroxide, people used to recommend that.
Yeah, but we now know it can cause really nasty hemorrhagic gastroenteritis, serious stomach and intestinal bleeding. Same goes for cats, by the way. Just avoid it.
Absolutely no hydrogen peroxide.
Yeah.
So call the vet is the real first step then.
Exactly. Call your vet or an animal poison control center immediately. They might recommend inducing vomiting, but they'll use safer medications like apomorphine for dogs or maybe xylazine for cats under supervision. Depending on how much was eaten and the signs, they might also consider things like gastric lavage, flushing the stomach, or using activated charcoal to bind the toxin.
Right. Leave the treatment to the professionals. What else might a vet do?
Well, for those skin reactions, they might give antihistamines. If the dog has tremors, there's a muscle relaxant called methocarbamol they can use. There are specific dose ranges for that, based on weight and severity, up to a maximum daily amount. And IV fluids are often really important, too, just for general support, hydration, helping flush the system.
Okay, supportive care seems key. So after all that, what's the prognosis usually look like? Do they recover? Okay.
The good news is yes. With prompt and appropriate veterinary care, most pets recover fully. We don't typically expect any long-term organ damage from this specific type of exposure.
That is genuinely a relief. So wrapping this up, the key takeaway seems to be neonicotinoids, while designed with a safety margin, can cause problems, especially for dogs if they eat them.
Precisely. That safety buffer exists, but accidental ingestion can overwhelm it, which really highlights how important proper storage is. Keep those baits, collars, liquids well out of reach.
Absolutely. Can't be too careful.
And maybe this leaves you with a final thought. Just take a quick mental inventory of your own home, your garage, your garden. Are there everyday products there, things you don't think twice about that could potentially pose a risk, even a small one, to your curious pets? What simple steps could you take, maybe right after listening to this, to make things just a little bit safer for them? Something to chew on, so to speak.